Hello. Hi everyone. We'll just be beginning in a little bit of time. We still have about a minute to go. So let's wait for a couple of more people to join and then we can start our session. Okay, so we're at 5:30. Let's begin the session. Hi, I am Dr. Priyam Sharma. I am a pediatrician and a practicing homeopathic physician and also a palliative care consultant. And I'm here today with you and with BabyChakra to talk to you about weaning. So let's start with our session on all about weaning. Let's begin with what exactly is weaning. So, weaning is the process of getting your child off breast milk or any milk top feed that you're giving your child and slowly, gradually introducing your child to solid foods. When we say that okay, as a mother, if I come and I say that I want to wean my child, the most important thing that comes to my head is when do I begin and how do I begin? So let's start with the when of it. When do you begin weaning your child of breast milk or of milk in general? You can start beginning to wean your child of milk at the age of 6 months. So there is always a confusion whether it is 4 to 6 months or it is 6 months. According to WHO, by international standards, it is at 6 months of age where you can slowly, gradually start weaning your child. Uh, how do you go about it? So there are two particular ways in which weaning can be done in children. The first way is mummy-led weaning or mother-led weaning, which is the commonest way or the commonest practice that has been done for several hundred years, I should probably say, where the mother decides that now it is the time to wean the child, and these are the food items that I'm going to give my child so that I can slowly, gradually stop breastfeeding the child or stop feeding milk to the child. Now, mother-led weaning in India usually begins with some starch or honey water or rice water or dal ka pani or maybe some jawar or ragi ka paste, as we call it. Uh, Mother-led weaning has its own benefits. However, it is a lot of work. So usually, whenever you start with mother-led weaning, you start giving your child purees of foods or fruits or vegetables or dal ka pani or rice ka pani, etc., etc. And that takes its own sweet time. You have to have your preparation. You have to have your decisions when you want to begin what, etc. And a lot of times it becomes difficult because sometimes the baby is just not ready to wean yet, and therefore the process of weaning becomes very, very difficult, and it's like a trial and tribulation for the mother, where mother is going on trying, okay, I want to try and feed my child this, but my child is not taking this, or I tried feeding my child this, but he or she is not taking it, or my child is just not ready to take any solid foods, and what am I going to do? So there's a lot of stress that is related with weaning per se as well. And therefore, there is the second kind of weaning, which is a fairly recent development. I wouldn't call it recent, but a fairly recent development in weaning, known as baby-led weaning. Baby-led weaning is something which is very commonly followed, and it is uh, propagated by mothers and doctors alike. Over a period of time, it has actually become the norm that a lot of people follow baby-led weaning. And that's plain simple because it's your baby who's guiding you as to when, how, and what he or she requires as he or she gradually gives up on milk. Now, What and when should you start baby led weaning? Like I said, any weaning should start at 6 months of age, nothing before that, nothing you can go a little after that, but ideally 6 months of age is when you start introducing your child to solid foods. What are the food items that you can start your child on? uh, Normally, what we propose is, or what we generally advise parents to start kids on, is usually some kinds of vegetables or fruits, and then you slowly, gradually go on building up the palate, uh, the ability to judge textures and accept them. So basically the acceptance is what we gradually develop in the child. You start with vegetables or fruits. Make sure that you do not puree it completely. Mash it. You can probably use a carrot, boil it and mash it, or peas, you mash it and you offer it to the child. uh, when do you start baby led weaning? Another way in which you become sure that your child is ready to start weaning is when the child starts grabbing at your plate. So if you're sitting with a plate of food and the child starts grabbing at whatever is inside it and tries to put it in their mouth, know that your baby is probably now ready to start accepting these foods, and you can probably start by trying and giving them little quantities of the food. So yeah, now coming back to the mashed foods are more textural. Therefore, it gives your child the ability to accept textured food. Otherwise, there have been cases where children have been continuing to have pasty food for longer periods of time, because that's what their palate has been used to for very, very long periods of time once the weaning started. Therefore, try giving a little bit of texture in the food that you are serving to your baby. Uh, Now, with baby led weaning, another thing that is very, very important is how do you go about the process? So, you start by introducing one meal a day. That is, so if you are feeding your child, say, giving your child milk, say 7 or 8 times or 6 times in a day, one meal out of that is what you will change into one of the solid foods that we have mentioned earlier. Now, usually it is advisable that you start it during the morning or the afternoon time, for the simple reason that you have the entire day to observe if it is causing any allergic reactions or any untoward reactions in your kid, and you can take care of it in case of an emergency. Usually, most kids are not allergic to most vegetables and fruits, so it shouldn't be a problem, but it's always best to start at the initial phase of the day, or if you start in the middle phase of the day, whereby you can have enough amount of time to observe how your baby is accepting the particular food item. Now, the next thing is, you start with a food, give your child time to accept it. It is very simple. If I ask you to try something new, you might take a little bit of time. Your baby's palate has just been introduced to something new after 6 months of having only milk. So give it some time. There might be times